Hello, good afternoon. Thanks for being with us this time on this live Q&A. I'm Dr. Gutierrez. We'll be doing some live Q&As, and hopefully we can answer all your questions. Let me see if we have some questions. It's been a couple of weeks since I did the last Q&A, so technology changed a little bit. Para las preguntas parecen. Oh, okay. Oh, yeah. So we have no questions still. So gonna wait a little bit so we can have some more viewers and answer your questions. Sí, se veía, ¿verdad? Okay. We're just arriving from the hospital. We're at the new facilities, so hopefully next year we'll be here so we can take care of all of you. So today I did 3 surgeries, 3 gastric sleeves. So everything is doing fine. Okay, so we have the first question. Chrissy, thank you for your questions. Says, I'm flying to the East Coast after surgery. How often should I get up and walk around the plane? Okay, so a couple of hours. Normally, what we recommend is that that you can wear your stockings back on the plane. You tell the flight attendant that you had the surgery, so like every hour you can walk back and forth the aisle. And if you're in the airport, so you can be walking constantly. So like every hour, it's no big problem. Normally, when it's more than 5-6 hours, we recommend a blood thinner. But it's less, only the stockings can be moving around. Okay. Okay. We'll see if we have more. Sometimes we have patients from like New Zealand or across the world. So in that case, yeah, you should take a little bit more care about circulation and blood flow. Another question: that you supply the stockings? Should we come with them? Yeah, in the hospital we have them, but it will be better if you. Sometimes in the hospital they could get stained or something like that. So a lot of patients they bring their own, and yeah, it will be better so you can be more comfortable and well have them and it's better for your health. So you can bring yours. Let's see. Okay, so we're gonna wait a little bit more for questions. Okay, another question from Allison. Thanks, Allison. Uh, this question, the patients from today, they ask me the same question. So normally we do an approximate like 2 to 3 surgeries a day. Um, Sometimes it could be a little bit more, but that's the approximate. So this is for it helps because surgery is not that tired, and we can take special care on your surgery. Okay. So another question: what do we need to ask our doctor to check post-op? Normally, what we recommend is that, well, it's better if prior to your surgery you talk to your primary care doctor, tell them that you're gonna have the surgery. Um, right after, as soon as possible, you can return to him or her and tell that you had the surgery. It will be better to do some follow-ups at first, and then we wait like a month and like every couple of months, mostly to do some blood work to check on your vitamins, minerals, protein levels, and um, and just be doing a follow up. But your doctor is gonna recommend what to do. But yeah, it's always better to have a follow up. And if your doctor, if you have a nutritionist, that's always better, mostly for long term results. Okay. Okay, another question from Lori. Hello, Lori. I will be having the mini bypass by you. How long does the drainage take to subside? Um, Imagine this is the drain that we use. Normally, in all surgeries, we like to leave a drain. It's a Blake type drain or a Jackson Pratt drain. In case of bypass, we leave it 2 days because intestine heals a little bit slower than the stomach. There are a lot of centers all around the world that are avoiding putting a drain in because it could be a little uncomfortable, but we prefer to take all measures. It's always better to have a drain, and mostly if we were to have an active bleeding, we can tell by the moment, and we can start doing special medications to help with that. So in the case of mini gastric bypass, it will be 2 days, the day of the surgery, one more day. Sometimes the day after surgery, if you're doing fine, if everything's looking good, maybe in the afternoon we can take it out. Another question by Maria. It's bruising around the incision sites normal? Sometimes it is, because normally when we, like in every surgery, you cut, there's small vessels that bleed a little bit and could cause a bruising. In this case, we do laparoscopic, so we're gonna put special chokers. So you're moving the instruments and the choker it's moving, so sometimes a little bit of a bruise can develop around the incision site. But it should be a small bruising and it should relieve normally. hmm Okay, another question. What if my blood work levels AST and ALT are high? Will I still be able to have my surgery? Normally, these enzymes are predictors from your liver function. So if they're very high, they could tell us that you have some problems with your liver. Sometimes because even with fatty liver, they can get up. So we have some patients that are a little bit high, and we can still do the surgery without any problem. And actually, losing weight is going to help with that. Only if we have to check all your blood work, and if we have some problems from inflammation, sometimes it could be an infectious hepatitis or kind of like that. Maybe in those cases, will be better to wait a little bit. But we have to check all your blood work. Okay. Another question from Maria: how to handle insomnia? I'm not sure if this is after surgery or prior to that. Well, um, Sometimes, not in all cases, but sometimes insomnia could be developed by obstructive pulmonary disease. So in this case, patients that need like the CPAP machine, that they don't get a good rest, losing weight with the surgery, it helps a lot. So I'm positive that insomnia is gonna relieve a little bit as well, but you have to do some more studies after to check on that. Okay, another patient. Oh, Allison. I feel like. Oh, I'm not. Okay, I skipped one. Um, Ray, thanks for the info. You did mine on the 11th. Oh, hey, hello, Ray. Healing was very well outside of some gastritis, which can be helped. Okay. Um, Sometimes after mostly gastric sleep, you can develop some gastritis or a little bit of acid reflux. So what we recommend at first is that you continue taking your omeprazole, following the diet, and normally it gets better by time. There's a very small percentage of patients after gastric sleep that can develop or worsen acid reflux. So in that case, well, we start doing some studies and an upper GI endoscopy, and if it's very bad, the thing to do is to convert it into a gastric bypass. But I think in your case, it's to wait, follow the indications, and you should be feeling better. Okay, thanks, Ray. Okay, another question by Allison. I have a okay, another lab question. My iron levels are low. I'm on a supplement, but I will that prevent postponed surgery? Okay, so that would have to we have to see your hemoglobin levels. If they are very low, meaning less than 7, yeah, in that case maybe it had to be postponed for later. If it's between 7 and 10, and we do a complete a revision, sometimes the patient we can still do the surgery with the increased risk of needing a blood transfusion after. Not that you're gonna need it, but increases the chances. So we will have to check on that. But there's a lot of patients that come with a little bit of anemia, and most of them are because of blood loss. Um, okay. Okay, Marie, after surgery. Okay, insomnia after surgery. So yeah, we will have to do some more studies. I'm pretty sure that it's gonna help, but we will. I cannot tell that 100% it's gonna go away. You have to do some more studies, but positive that it's gonna help with that. Okay. Oh, skip a few. Okay. What do you mean, Maria? What do you mean by minimal invasive and laparoscopic? Normally, this is the same. We could do minimal invasive surgery or laparoscopic surgery. So this means that we're gonna do some small incisions, 3 to 5 incisions on your abdomen. The biggest one is left to the belly button is less than half an inch. So it's very small, and the other ones are half a bit, is less than a quarter bit of an inch. So very tiny incisions, faster recovery, less pain, and aesthetically, it's better. Now, a question from Chrissy Flanagan. I read that we should have a blood work done before we come. Is there a list of what should be tested? Yeah, normally with your liaison, they're gonna give you what exams, what blood work should we need, and it's always better to do one prior so we can encounter some problems. Still, when you come, we're gonna do another lab work and a complete pre-op testing. But it's always better before you leave to know how your lab works are. Okay, I think they already answered that. Another question: will the January surgery will be in the next facility? We're not sure what time will be working completely in the new hospital. I'm not sure. Maybe you can continue checking with the company, but hopefully we can do it the soonest possible. Okay, now question from Bobby. I was just put on an inhaler for asthma. It is okay to keep using it up to surgery? Yes, yes, of course. Actually, you have to use it. We're gonna do medications to help you, special medications, nebulizations during surgery after, and right after you continue taking your inhaler. But uh, but fortunately, losing weight is gonna help with that as well. So hopefully you can lower the dose or get rid of it later on. But yeah, it's gonna help. Right now, you continue using it as usual. Okay. Another question from Maria. Other side effects or possible complications from the surgery? Yeah, as all surgeries, as all procedures, there could be complications. Fortunately, right now, worldwide data, and our data is less than 0.5%. Normally, worldwide data, sometimes it's up to 1%. We have less, we have 0.5%. Um, Possible complications, what we're more aware of is obviously, in any surgery, bleeding first, but that's why we keep you here in the hospital. So most of the bleeding are in the first hours. So by the time you get discharged, the risk of a bleeding is very rare. And the other one is that we take care is a leak, possible leak. It's very rare as well. We do 2 leak tests during surgery before we finish, and then we wait 24 hours for our stomach to heal a little bit, and then we do one more. That's it's called a leak test. Uh, Another is like a barium swallow, but it's from the iodine. But just making sure everything's okay. And it's very important for when you get discharged that you follow the indications, you follow the diet. We're going to continue on a 4-step diet. The first step is just liquids, and then we move on progressively. I know that you are hungry, you want to eat something solid, but eating something solid the first couple of days, like I tell my patients, imagine that we put a patch. It's like a balloon. We put a patch in it. You let it rest. You don't go and inflate it right away. So that's what causes if you eat something solid. So most of the complications of the leaks after, it could be because of not following indications. So just follow indications and you'll be fine. Question from Ray. My sleep apnea symptoms have already settled. Oh, good. Glad to hear. Down greatly, and it's only been 3 weeks since pre-op and post-surgery. Down 25 pounds already. Breathing feels way better. Well, congratulations, Ray. And this is just the start. So imagine how you're gonna feel later on. You're gonna look good. You're gonna feel good. And normally, as I always said, we know now that obesity takes 10 years from your life. So doing this is regain those 10 years and live it with the best quality. So you're starting to see that. So keep up the good work and you'll get there. Okay. Okay, another question. Oh, this is a holiday question. Merry Christmas. Thank you, Maria. Um, what will you be doing for Christmas? I'm gonna be here with the family. Still, we're gonna be doing surgeries. We're just off the day for Christmas, but we still taking care of our patients, and a normal dinner with the family. Hopefully, you could be with the family and have a happy holidays as well. Okay, this is another question from payment plans. I think the liaisons are gonna answer that. They know more, so they're gonna get in touch with you, Diana. So they tell you all about the financial payments. Mm, okay. Okay, another question from Bobby Paul. Thank you. Are there extra recovery rules if you have to fix a hiatal hernia? Um, Normally the recovery is the same. We follow the same indications, the same rules, it's the same hospital stay. So you just have to follow the same rules, and you'll do fine. It's a little bit more of dissection. Surgery could be like 15 minutes more, but the recovery is almost the same. Mm, Another question: is it dangerous binge eat after gastric sleep? Uh, well, yeah. Well, this is gonna depend on the well. If it's right after surgery, yeah, it is. We have to let our stomach heal. Your stomach's gonna be stable. It's gonna be soothed, but we have to let it heal 100%. Whenever we do a gastric sleep, we're gonna remove 80% of your actual stomach. So in that 80% that we remove in the fundus, there's a lot of hormones that are produced. The most known one is ghrelin. This it's called a hunger hormone. So after removing that part, we're gonna remove most of your body's ghrelin production. So that hormone goes into your brain and causes you that hunger, that binge eating sensation. So after surgery, that's why patients don't feel that same hunger, that binge eating. So still you have to take care, but you will have less hunger. You will see because of that. Okay. Okay. Just had a gastric sleeve on the 15th. Surgery went fine, and I'm following my pre-op plan. Everything's great. Well, glad to hear. Thank you for your comment, and hopefully you keep up the good work and see the results very soon. Congratulations. Okay, another question. I'm scheduled with you for bypass on January 8th. Um, are there variations in the pouch size from different surgeons, or are they all the same? Well, the gastric pouch, it could be when I was studying bariatric, it was a little bit more than 10 years. Our professor said that the key for the gastric bypass, it was leaving a very tiny pouch. Right now, we've seen that the pouch helps, but it's not the one that's gonna give you all the results. This is a malabsorptive surgery and a restrictive. The pouch is gonna be the restrictive part. With time, it could grow a little bit, not that much. But in case of a gastric bypass, keep in mind that you're gonna eat, and food is gonna go directly into the intestine. It's gonna stay a little bit in the pouch, but it's gonna go directly into the intestine. So it's not the same result as with the sleep. So sometimes patients with bypass, they want to feel the same restriction as with the sleep. It's a little bit different, but yeah, normally we tend to have not too big of a pouch, but not too small, so you can have some problems. But we will see in your case, and we'll be glad to have you here and see you on January 8th. Thank you. Okay, another question, Maria. I'm not sure if this is a myth. Can I chew gum or drink from a straw? Well, this is a common question. Um, at first, your stomach is going to be very small. So whatever causes you to take a lot of air inside is gonna distend your stomach and gonna cause a little bit of pain, discomfort, nausea, even vomiting. So um, taking any liquid from a straw, it's gonna take a lot of air into your stomach, so it's gonna cause discomfort. So that's why we recommend not to use a straw at first. Chewing gum could be a little bit less than a straw, but still, you can have some problems. So that's why we prefer to take all measures and not do that the first couple of months. Later on, you can be able to live your life at the same. Okay, another question from Laurie. I've had several abdominal surgeries. Will the incisions be bigger because of scar tissue? Do you do any scar tissue removal? Yeah, this is gonna depend on if the surgeries were openly done or laparoscopic. Normally, the incisions are not bigger. Sometimes, very few cases, we have to do one more trocar, one more incision. But no, it shouldn't be any problem. And yeah, whenever we go inside and this is a revision surgery, we have to remove scar tissue that's in the way, and we always do that. So surgery after it's better. So it's a little bit more dissecting, but the same. Um, okay. Question from Carly: if you already have surgery scars, oh, it keeps on your stomach, will you go into those or create new ones? This is gonna depend. Normally, when we do laparoscopic surgery, we're aiming at the organ that we're gonna work on. Um, Sometimes the patients have previously lap bands, where lap bands they work on the upper part of the stomach, and in this case, honestly, we're gonna work on the whole stomach. Some patients they have gallbladder surgery, some patients they have pelvic surgery. So sometimes we have to create new ones. We always take care of aesthetics, and if we can go through the same one, we'll do. But sometimes we have to do new ones, small ones, a small incision, but to be a safe procedure. So we'll see when you're here. Okay, another question from Maria. My sister is coming in for surgery with you next month. Any tips on calming my nerves before surgery? So it's normal to be anxious, to be nervous of having surgery, but you just it's very important to follow the diet, the pre-op diet. Sometimes if you can go to a primary care doctor, if he considers to do some medications to calm the nerves, he can do that, and and the rest will be just follow indications, and when you're here with us, we're gonna make you feel the less anxious possible. Okay, another question from Ray. Is obesity as much of an issue for Mexican citizens than Americans? Well, yeah. Mexico, it's the number one in obesity, in child obesity, number one, and number two in adult obesity. Number one in adult obesity, it's United States for now, and number two is Mexico. This is because of the proximity, because we've been eating fast food, all of that. There's other countries that are increasing their obesity rate. So Saudi Arabia is increasing a lot. China, on their child population, it's increasing. So we know by statistics that in 2030, 50% of all population, worldwide population, is gonna be overweight or obese. So imagine this is a pandemic, way more severe than COVID. Okay. Okay, another question from Ryan. When you bring two companions, will there be two beds at the hotel? I'm pretty sure at the hotel, but you have to talk to the liaison. They're the ones who knows best about that issue. So you're gonna get contact by them. But I'm pretty sure they can arrange that. Another question from Kaylee, or comment. I came in for surgery December 1st. My surgery was with you, and you did a fantastic job. Oh, thank you very much. You're too kind. But my question is, I am stalling on my weight loss. Actually, have gained some from the weight I lost, and I'm in phase 3 post-op diet now. Is this normal? Well, not in all patients happen, but sometimes in some patients it could be because of the diet that you're having, some medications that you take, maybe some liquids. There are There, what we recommend is that, mostly in this case, that you're not losing anymore, if you can go to a nutritionist or to primary care doctor to check on that, and see maybe they can change the diet a little bit, and so you can keep losing weight as much as needed. But I'm pretty sure that you're gonna get there. Some patients, they just take a while. Okay, another question from Wanda. I have a lap band. Do you do the revert to sleep? Yeah, we do a revision surgery, and we take that lap band out and we convert it into a gastric sleep. So yeah, we can do that surgery for you. Question, you don't have to worry about running out of work. Well, no, it's like a race mostly. Where every year obesity is increasing like 3 to 4% population, and we're doing just 1.5 to 2% of surgeries. So the race is it's winning. Obesity is winning, and it's gonna develop a lot of problems, and mostly on our young kids, our childs, because they're gonna develop diabetes, high blood pressure, um, strokes, heart attacks very young. So that's the problem that we have to start taking care of from now. Okay, Maria, is it normal to regain some weight back? Yeah, well, it could be. Normally, the surgery, I tell my patients, surgery is a tool, an excellent tool, but it is still a tool. The first year or 2 years, the surgery can do all the work for you. Later on, you can like feel that you can fit more food, that you're gonna you start eating back again. So most of the patients after 2 years, they can regain weight. So that's why you can, if you head back to a nutritionist, take care of that, and you will still be losing weight, because yeah, you can regain weight. Our body is it's meant it's created to absorb our fuel, not to throw it away. So by time we develop some mechanisms, and we have to be a step ahead of that. Okay, so I think we're in time. So just patient Laurie and Desiree. Um, Thank you very much. Okay. I will be glad to see you here, and thank you all for connecting to be here, spending a little bit of time with us. Hopefully, all your questions was answered, and if not, you just send them, and hopefully in the next live Q&A we can answer them all. So thank you very much. Have a happy holidays, and we will see you soon. Okay. Thank you. Bye bye.